SafeMed team is a group of frontline staff members, pharmacists, nurses, pharmacy technicians, and some managers who get together once a month to improve medication safety at Chatham-Kent Health Alliance. Before SafeMed team, we would deal with incidents one at a time. And so if there was something critical that happened, we would try to correct something about the system to make it so that it was less likely to happen again, but there wasn't really a coordinated effort to do that. SafeMed team's been in place for about 2 years now, and so we've had a bunch of successful projects that we've completed over that time to improve patient safety. The most recent project that we worked on was improving labeling on some of the IVs that nurses supply to patients upstairs on the nursing units. We were noticing a trend of patients getting incorrect IVs, and we were finding that nurses were spending a lot of time looking for IVs on their carts because of poor labeling. And so our efforts were to relabel them in a sort of easy to see and easy to use format. And we cut the time for a nurse to find what they're looking for in half, which can be pretty important in critical situations. And we're hoping to see a reduction in the number of errors that we see with wrong IVs being administered. One of our other initiatives was to implement a high-risk medication list. So this is a list of medications that if things go wrong with those medications, the outcomes can be serious. So we wrapped some new procedures and precautions around those meds to reduce the risk of those things causing harm to patients. We think it's really important to have frontline staff input on this team as opposed to having managers sitting around and making decisions, because the people on the front lines know where the risks are and where the confusion lies, and so having those folks on the team is vital to having good outcomes. With the help of that staff input, SafeMed team will continue to work on initiatives to improve patient safety and serve as a resource to other groups that are working on medication administration.